Um, so this is my patient. Her name is Betty, and she presents today with a right humerus fracture, and she fractured her humerus 6 weeks ago. She is in a lot of pain. She is reporting 8 out of 10. She, as you can see, she is even having to hold her arm. She needs that support. So some of her goals right now is pain modulation, okay? She wants to try to get some relief for those symptoms that she's having. So as treatment option, not treatment option, but like more like a physical agent, like a secondary treatment option, I was considering the TENS in the conventional settings, okay? But even before we can consider that agent, I wanted to take in consideration some of the contraindications, okay? So I have already checked her medical history and have ruled out some of the contraindications for TENS. Some of them being the presence of any cardiac implant or pacemaker or defibrillator. See if since we're not gonna go on the place it on the carotid sinus, that's okay. We can go ahead and do that. Also, in her medical history, it doesn't show anything for blood clot, and I have already confirmed that with you. Do you have any history of blood clot? Okay. And also, I wanted to confirm with you that you're not pregnant, or you're not planning to be pregnant, right? Okay. So even before we do any of this, I wanted to make sure that you are okay with me using electrical stimulation, because you may not know what TENS is, but TENS is applying a little bit of electrical stimulation, okay? To provide a pain relief. So is that okay?
That's okay.
Okay. So I also wanted to obtain consent, okay, and see if it will be okay for me to work on you. Okay?
Oh, you can do it.
All right. So basically the reason, as I stated before, and going back to her goals, the reason why we're using TENS is to modulate that pain. And we're going to use it with the conventional settings because she's already in a lot of pain. She had reported to be in 8 out of 10, so we don't want to exacerbate that with using the acupuncture setting, okay? And the conventional settings, they act on the gate theory, okay? While the effects are, they don't last that long, for her case, it's kind of like what she needs, the option, okay, available. So I wanted to explain a little bit what we're gonna do. So we said that there's electrical stimulation, so we're putting two small little patches on the right side, like in the front part of your shoulder right there, and on the back. I might have to fold the sleeve a little bit for that. Is that okay?
Yes.
Okay. So once I put it on, it should feel like a tingling sensation, but it shouldn't be painful at any time, okay? And if it does feel painful, please let me know, okay? So we can adjust, okay? Also, as I explore the area, I'm gonna make sure, because that could also be a contraindication, right? That if we see that she has any skin reactions, or I can go ahead and right now because I didn't address that before. If she has, do you have any like allergies to adhesive or anything like that? No, right? So okay. So after I have explored the area and it's okay for me to apply electrode, I will go ahead and do that. And also, as a pre-test measurement, will be the pain level, and she have already addressed that. She said that it was 8 out of 10, and I have already confirmed that with her. Okay. I'm sorry. Right there. another one. For in a normal situation, I will go ahead and clean the area, okay? But since we don't have that available right now, I wouldn't be doing that, okay? So we're connecting this unit. Okay, as far as the settings, since we're going for the conventional type of setting, on the test unit, we want to go for a frequency of 120. The pulse duration will be right at 70. And then we go ahead and start adjusting the amplitude until it's comfortable for the patient. Please let me know if at any time, are you okay right now?
Yep.
If at any time it feels uncomfortable, please let me know, okay? That's it to you?
I feel some buzzing in my shoulder.
It was in the same folder you assigned?
Is that okay?
Yeah.
Okay, so what we want right now is to feel that little contraction, okay? More like a buzzing, more like a tingling sensation, okay? It shouldn't be painful. So for this treatment or this therapy more like will normally will last about 20 minutes, okay? But because of the purpose of this assignment, we're gonna go ahead and end the therapy right now, okay? So I'm gonna turn off the amplitude. And right now, I will check the area, ensure that there is no redness, okay? As I remove the electrodes, make sure there is no irritation in the skin, okay? Another thing that I will do, I will address to the patient the fact that if it is red right now, that is like normal, that's okay. But to keep an eye on it and make sure that there is not another like greater level of redness in the area, and if there is, to please let me know so we can address it. For future treatments, we can either, that might be a parameter issue, or we can use another type of therapy. And of course, at this point also, I will go ahead and ask the patient, so what's your pain level right now? Are we still on a 8?
No, I think it feels a little better than 8.
Okay, great. So that's how I will address the post-test. Basically, since we are looking for symptom modulation, I will address pain, pre and after the treatment. Alrighty, thank you so much.